Good evening, everyone. I'm Leslie Abney. Thank you for being with us on this Tuesday. And we begin tonight at City Hall, where we are learning more about the final autopsy report of a 6-week-old baby boy diagnosed with COVID-19 who died back in July. Health officials releasing the medical examiner's findings during this afternoon's City County COVID briefing. Our Bill Churchwell is there and joins us now with those details. Bill?
And Leslie, you might recall the infant is the first child to die with coronavirus in Nueces County. The final autopsy report confirming that today. The cause of death listed as medical complications from COVID-19. Now, an autopsy was requested following the boy's death to determine the exact cause. Originally, we reported that the infant was hospitalized for respiratory-like symptoms, treated, and later released after responding to a doctor's care. A week later, on July 10th, the boy was found to be unresponsive at home and passed away. But because the baby had tested positive for COVID-19, his death was counted as COVID-related. Now, health officials explaining the final report today here at City Hall. Take a listen.
The autopsy from the medical examiner office reveals that this is a 6-week-old baby, and the cause of death to be from the medical complications of COVID-19 viral infection, and bronchopneumonia listed as other significant condition. On the postmortem examination by the medical examiner, they found microscopic blood clots in the lungs, spleen, and pancreas consistent with COVID-19 complications widely reported in the literature. And the baby boy tested negative for COVID-19 postmortem, but given the novelty of this virus, there is a limited information on the postmortem viral molecular testing at this time to know if this is significant. And
Now, again, I want to let you know the cause of death was COVID-related. Pneumonia was listed in that report. The baby actually tested negative for the virus post-mortem, meaning after death. Still, the autopsy revealed microscopic blood clots in the baby's lungs, spleen, and pancreas, which, again, is commonly associated with coronavirus. Health officials continuing to stress the importance of taking precautions against the virus. Reporting live from City Hall, Bill Churchwell, 3 News. Now back to you.
All right, Bill, thank you so much for that update. And we continue to follow up on information from the Nueces County Public Health District about the number of babies who have tested positive for COVID-19 within the county. That latest update was brought to us last night, so let's catch you up to speed. Officials with the City County Health District confirmed that 219 babies under the age of 24 months have tested positive for COVID-19 in Nueces County since March. This latest information comes after a second round of data drops from testing locations conducted by state and private facilities. The health department did not disclose how many of the 219 babies are actively infected with the virus or how many of them were asymptomatic. And you may remember back in mid-July, Nueces County had reported 85 infants under the age of 2 who had tested positive for the virus. And just last month, the health district reported that the number of babies who are COVID-19 positive was close to 167 total.